Hey class, my name is Edward On and I did my Teach 1 topic on artificial intelligence. So what is artificial intelligence? Artificial intelligence leverages computers and machines to mimic the problem solving and decision making capabilities of the human mind. So basically, it is the science and engineering of making intelligent machines, especially intelligent computer programs. It is related to the similar task of using computers to understand human intelligence. And AI is a field which combines computer science and robust data sets to enable problem solving. Before I talk about AI in healthcare, I want to talk about deep learning versus machine learning. So, machine learning is a type of AI, while deep learning is a complex part of machine learning. So, deep learning and machine learning differ in how each algorithm learns. Deep learning automates much of the feature extraction pieces of the process, eliminating some of the manual human intervention required and allowing the use of larger data sets. So basically, deep learning uses a complex structure of algorithms modeled on the human brain. This enables the processing of unstructured data such as documents, images, and text. Moving on to machine learning. Machine learning is more dependent on human intervention to learn. Human experts determine the hierarchy of features to understand the difference between data inputs, usually requiring more structured data to learn. So basically, machine learning means computers learn from data using algorithms to perform a task without being explicitly programmed to. Moving on to the next slide, what is AI in healthcare? AI in healthcare is described as the application of machine learning algorithms and other cognitive technologies in medical settings. So, AI is when computers and other machines mimic human cognitions and are capable of learning, thinking, and making decisions or taking actions. AI in healthcare then is the use of machines to analyze and act on medical data, usually with the goal of predicting a particular outcome. So, the most common and significant use case of AI is the use of machine learning for medical diagnosis purposes. Using patient data and other information, AI can help medical providers deliver more accurate diagnoses and treatment plans. AI can also help make healthcare more predictive by analyzing big data to develop improved preventive care. Why does AI in healthcare matter? And this sort of has to overlap with the previous slide. AI can assist doctors, nurses, physicians, and medical providers in their daily work by enhancing preventive care and quality of life, producing more accurate diagnosis and treatment plans, and leading to better patient outcome overall. It can also help them by predicting and tracking the spread of infectious diseases by analyzing data from government, healthcare, and other sources. This can help them in global public health as a tool for combating epidemics and pandemics. Moving on to the next slide, AI and electronic health records. I want to sort of talk about how AI can affect EHRs, but before I do that, I want to quickly go over EHR. So, electronic health records is the ability to exchange information electronically, and it can help provide patients higher quality and safer care while increasing efficiency on how medical providers manage care for patients. However, there is a problem with EHRs. So, a U.S. study by American College of Physicians found that doctors spend an average 60 minutes per patient on EHR functions across specializations. So, this is a problem for U.S. healthcare systems as the more time physicians spend on these EHR functions, it translates into higher costs for patients as well as leading to physicians burning out. So, a solution to this is to use AI with EHR systems. So, how does AI affect electronic health records? AI makes EHR systems more efficient by reducing administrative burden of clinical documentations. So, nearly 50% of clinicians' time is spent on admin work, including documentations, order entry, billing, and system security. So, not only does this go into or take up the patient's time, but it also contributes to the excessive work and dissatisfaction that can lead to the physician burning out. So a solution to this is to automate the capturing of clinical notes through natural language processing, reducing clinicians' admin work, and this in turn can free up more time to focus on patients. Moving on to the next point, AIs can make EHR systems more efficient also by automating extraction of patient data. So patient data needs to be easily accessible to providers for faster diagnosis and decision making. So it should be clear and easy for clinicians to interpret the data accurately. However, sorting through the large amounts of EHR data is a huge challenge. A solution to this is that we can allow AI-enabled EHR systems to allow clinicians to rapidly access extract and electronically export patient data with minimal error. Moving on to the next point, enhanced clinical decision making. So the large data created by EHR systems can implement itself to these advanced AI and machine learning tools to uncover patient insights, predict high-risk conditions, and enable more personalized care. And moving on to the last point, achieving EHR interoperability. So the lack of common standard for capturing, managing, and transmitting patient data makes it difficult to analyze information from different EHR systems. Without interoperability, there's always a risk of information getting lost when shared digitally with multiple health providers. This creates delays and inaccuracies, and it can ultimately affect the quality of care and patient outcomes. So a solution to this is that some organizations have started to use AI and machine learning to solve interoperability issues in clinical documentations. AI platforms can use AWS services to allow for cloud-based EHR infrastructure interoperability with outside data sources. Now, moving on to my last slide, these are just other areas where AI can improve healthcare. So AI can improve healthcare by supporting medical imaging analysis. And what this means is that it can support a clinicians reviewing images and scans, and this enables radiologists and cardiologists to identify essential insights for prioritizing critical cases, and it can help them avoid potential errors in reading electronic health records and to establish more precise diagnosis. Moving on to my next point, analyze unstructured data. So clinicians often struggle to stay updated with the latest medical advances while providing quality patient care due to huge amounts of health data and medical records. EHR and biomedical data created by medical professionals can be quickly scanned by machine learning technologies to provide prompt, reliable answers to the clinicians. Moving on to my next point, it can provide valuable assistance to emergency medical staff. So an example of this would be if I had a heart attack, the time between the 911 call, the 911 call to the ambulance arrival is crucial for recovery. So for an increased chance for survival, emergency dispatchers must be able to recognize the symptoms of a cardiac arrest in order to take appropriate measures. So what artificial intelligence can do is analyze both verbal and nonverbal clues in order to establish a diagnostic from a distance. Moving on to the next point, it can contribute to cancer research and treatment, especially in radiation therapy. So in cases, radiation therapy can lack a digital database to collect and organize EHRs, which makes the research and treatment of cancer difficult. In order to assist clinicians to make informed decisions regarding radiation therapy for cancer patients, you can have a platform that collects the relevant medical data of patients, and you can evaluate the quality of care provided, and share it among different EHR systems as well. And my last point, you can use the data collected for predictive analysis. So you can turn EHRs into an AI-driven predictive tool, which allows clinicians to be more effective with their workflows, and it allows them to be more effective with their medical decisions and treatment plans. So machine learning can read the entire medical history of a patient in real time, connect it with symptoms, chronic infections or illnesses that affects other members of the family, and this in turn can result into a predictive analytic tool that can catch and treat a disease before it becomes life-threatening. And these are my references. That is the end of my presentation. I hope you guys enjoyed it and have a nice day.